Thank you for staying with us. It is still the conversation here on Lagos Television. And on this side, we'll be discussing a very important health issue that affects millions of Nigerians, not only Nigerians, even outside Nigeria. And I am talking about malaria. Despite being preventable and treatable, malaria continues to be a leading cause of illness and death, particularly among children and even pregnant women. Here in Lagos State, the government has intensified its malaria prevention and management campaign to reduce infection rates and improve access to quality healthcare services. Joining us to tell us more about this initiative and what the Lagos State government is doing and has been doing and concerning malaria, we are joined by Dr. Abimbola Oshinowo. She is the manager of the Lagos State Malaria Elimination Program, and she'll be shedding light on this important topic, malaria prevention and management campaign in Lagos. You're welcome, Dr. Oshinowo.
Thank you so much for having me.
It's good to have you back again.
Likewise.
All right, I know you were here last year and we talked about malaria. And when you walked in, I said we are discussing malaria again. So from last year up until now, what's the current malaria burden here in Lagos? Okay,
so it's shown that there has been a reduction in prevalence based on some studies that have held in the state. And apart from that, a lot of activities have been geared towards it. Between last year and this year, quite a number of things have been done. One of which is the pathway to malaria pre-elimination and digitization. It's a project that is being done in collaboration with the World Bank, with support from the World Bank. And it has to do with the involvement of the private sector, particularly the pharmaceutical service providers. We're looking at our community pharmacies and patent medicine vendors. We have trained them and they are doing malaria screening before they sell any form of anti-malarials if the result is positive. If it isn't positive, the patients or the clients are referred to the nearest primary health centers for further studies. And the beauty about it is there has been a lot of behavioral change among the group of the pharmaceutical service providers that we're dealing with. Many of them that have had the information, or should I say, that have believed that every fever is malaria, they are now changing their ways. And they're even encouraging the patients that, look, it's not malaria like you think it is. It's something else that there was one that reported that said even she assumed it was malaria, when she tested herself and discovered it was negative, she had to test further and she got better. So she's like an advocate. Okay. So that is what we want people to understand, particularly our service providers, not just the pharmaceutical service providers, but any facility or any healthcare provider that is rendering services with terms of malaria, that you have to test before you do any form of treatment for malaria, because it doesn't necessarily have to be malaria, because there are many other causes of fever, malaria being one of them.
Especially for mothers who have little children, you know, when the child is down with cough, catarrh, or a little fever, you say, oh, now malaria. So what are you also doing to ensure that young mothers going into the grassroots, the communities, are also educated about this?
That aspect is quite vast. Why am I saying that? If you're looking at our children, we want to consider, apart from the fact that they are meant to sleep inside mosquito nets, not just children, but pregnant women as well. We're also looking at environmental management, because many of us do not realize we may be breeding malaria, or we may be breeding mosquitoes and encouraging malaria within our vicinities, in our spheres of influence, in our homes, for instance. If the house doesn't have running water, there's no potable water, and you have containers, those containers can serve as breeding sites, and those can actually go ahead to breed more mosquitoes, and then malaria is inevitable in such places. Or you even have containers at home, not necessarily in the watered containers. You may have rubbish dumps or rubbish or refuse all around the homes, which some of them can contain water. For instance, sachet packets for whatever reason can actually form like pockets. You can have plants that have very wide leaves. They can serve as breeding sites. You can have flower pots that can serve as breeding sites. Those are the things that we need to make everyone understand, that you can actually within your vicinity breed mosquitoes and can result in malaria. And when that happens, you want to ensure that you educate the populace that area, clean it up. You'll be surprised how much mosquitoes will reduce and malaria inevitable. And then, like I would say again, if for any reason the child is ill and you take the child to the facility, let them get those children tested first. Because with children, they can have gastroenteritis that can mimic malaria. They can have respiratory tract infection that can mimic malaria. They can even have COVID-19 that can mimic malaria. So it's not sure where you assume that the child is ill and is malaria, but get that child tested. It can even be an ear infection that can look like a malaria, malaria. So it's important that we test before we treat.
Especially now that the rains are here, what are the preventive measures that people can take to ensure that they don't become manufacturers of mosquitoes?
One of which is sleeping inside the mosquito nets, the insecticide treated nets. Why do I say so? It's important that you prevent yourself from getting bitten by mosquitoes, and one way is by sleeping inside the nets. And as much as you can in the evenings, you wear things that cover your body, you minimize the exposure of your skin, so that you don't get bitten. Then environmental management, I'll keep emphasizing that, because those pockets of water you have around your homes can serve as breeding site. What are some of the things you can do is just to fill up those holes, just pockets. You may have potholes at home, within your premises, within your compound. Pour sand in it, and that's it. So there are very minute things that you can do as individuals to prevent the breeding site. Then your gutters too, clear them, because those things, if you can have places that mosquitoes can go ahead to lay their eggs, and when we know we can get rid of them, then the mosquitoes population will reduce.
All right, still talking about malaria, could you highlight the major objectives of the Lagos State Malaria Elimination Program?
What we intend to do, what should I say, what we focus on is to ensure that prevention is at maximum level. We test, we treat, and then we track. Why do I say so? I like to use this analogy. If you take a pyramid, if you're able to do your prevention very well, prevention is at the base of the pyramid. It's quite wide, and then it tapers. If prevention is done very well, then the treatment, the diagnosis and treatment portion is reduced. But then when prevention isn't done properly, then you have a lot more people being diagnosed and being treated. Why? And when you look at prevention, a lot of things come to play. It's not just a health problem. It's actually an economic. Malaria is actually an economic problem, because everybody has a hand to play that. We're looking at Ministry of Environment, for instance. We talked about environmental management, our drains, our gutters. We want to ensure that there's free flow of water for whatever reason. Nothing is blocking it, because when you have floodings here and there, there's a backlog. And when there's a backlog, you have water being retained. And when there's water being retained, there are breeding sites. And beyond mosquitoes, other pests too would have homes to produce and manufacture, should I say, to transmit all their diseases. We're looking at Ministry of Education, for instance. Our children, when you teach a child something, the child runs with it. When we educate our children on how to prevent malaria at home, be rest assured the house is in order. There's no way they would not keep hammering it into your ears what they have been taught. Exactly. Same thing with our teachers. We educate them on how to prevent malaria, and that way the children, they can teach the children appropriately, and then they transmit that information in. Ministry of Housing is also very important in prevention of malaria. Why do I say so? And town planning. Why do I say so? The way you build your house, if for a reason you have an estate, for instance, and such estates, they're just haphazard, you would end up blocking the channels where water can flow. So when you put them appropriately, when you mark an area that is being meant for building, and then you build as appropriate, you don't have breeding sites, you don't have flooding, all of that, there's thoroughfare of water. Likewise, Ministry of Works, our roads, potholes and all, when we ensure that the roads are properly done, there are no potholes here and there, you don't have breeding sites. The same thing with the women affairs and poverty alleviation. Where do I come in? When a woman is educated, the entire home benefits from it. So when we empower women with such information, they run with it. So everybody has a part to play. And then you also want to talk about the fact that if you look at our various across the states, if you think about how the development has improved, a lot of estates are springing up. Let me use Etios as an example. Abramade Soya was kind of, a bit of a rural area at a point, and now there's a lot of estates, houses. The place has become more habitable, And as you go further down towards Ekpe, a lot of things are happening, a lot of development. Those areas we used to have a lot of breeding sites, and all of those things are no more. Why? Because development has ensued and we have gotten rid of breeding sites. Part of the reason why the prevalence in Lagos has also come. So urbanization has actually added to the trend of reducing the prevalence of malaria in the states. Likewise, for the treatment, for the diagnosis portion, testing portion, we have, do a lot of sensitization and then even capacity strengthening for our health workers on how to do proper testing, either using the malaria rapid diagnostic test kits or the microscopes. So we have trained our health workers, the appropriate ones, on what to do and what is expected of them to do in terms of when a patient comes in with fever, you want to test. And then the treatment, we have our drugs, which are given free at the public facilities, anti-malaria medicine, artemisinin-based combination therapy. And apart from that, you have done all of these things. Let's even know whether we're doing well or we're not doing well. We are tracking. How are we tracking? The data that we are getting is actually informing us on whether we're doing well or we're not doing well. How? When you get the information, it would actually tell you the kind of intervention you need to do in specific LGs. Let me give you an instance. If we demarcate the state as it is into senatorial districts, Central has a lot of urban LGs, and those areas actually have lower prevalence than either the west or the east. They're a bit more rural or what we call peri-urban. Development is still springing up in those places. If I'm going to do anything regarding malaria, the interventions I'm going to deploy are quite different. For those peri-urban areas, there's something called indoor residual spraying, where we would spray the homes with chemicals, the walls of the homes with chemicals. And what happens is the mosquitoes perch on those walls. They end up taking a bit of the insecticide and then they die. Right in the urban setting, the central area, I would rather do larval source management. So we're looking at environmental modification, which actually applies in all of them. Manipulation still applies in all of them, and then there's larviciding, where we use chemicals or biolarvicides in areas like gutters and other small portions. We identify places, not really fumigation, but it looks like, but it's not, that's not what it is really. What is, we identify different breeding sites and then put biolarvicides there, such that the larvae of the mosquitoes are being destroyed by those by the insecticides that I've just talked about. So basically, like I said, so the data actually informs us of which kind of intervention, or is it that the state will benefit from mass distribution of nets, for instance, where we give nets to everyone around based on some formulas that we have generated, and everyone benefits from the nets to ensure that they sleep inside the net. So our data actually helps us. So when we track, that information is given to us to know what kind of interventions to deploy in any area in the state.
From everything you have just said, malaria is way beyond just falling ill and then going to a pharmacy to get medication and all that. Because you talked about the Ministry of the Environment, Housing, WAPA. Wow, I never saw it in that light before, but my mind has been enlightened from this conversation. Let's still talk about some myths and misconceptions of malaria. I've heard someone say, oh, the doctor told her that everybody has malaria. Once you test everybody has malaria. Is that true? I'd like to know that.
Not everybody has malaria. Like, I'll use Lagos. I still use Lagos as an example. Our prevalence is low. So if somebody comes in with a fever, malaria is not the first thing I'll think of. That's why I need to test to be sure that what I'm treating is what I'm treating. So some other states, like Kebbi State, for instance, the prevalence is quite high. It's almost about 50%, meaning that if if two people are stoned, chances that one person probably has malaria. Unlike in Lagos, where it's about 2.6%, let's assume it's 3%. So if 100 people are here, just about 3 people would be thought to have malaria. So it depends on where you are. The prevalence of malaria in Lagos is the lowest in the country. So as it is in Lagos, malaria is not a disease that, occurs just like that. And if you think about it, when was the last time you had malaria? It's probably been a while. So technically, malaria is not that common in Lagos as one used to think. And malaria is an overdiagnosed disease in Lagos.
Any other myths, misconceptions that you would like to tackle?
Some other individuals have said that if you stand in the sun for too long.
Yes, especially in the afternoon.
Yes, it's malaria. No, it's not. Malaria is caused by Plasmodium. And there are 4 major species of it. And if for any reason the person has a fever, if you go and get tested, it's probably not malaria.
Then what about those for pregnant women? Misconceptions?
The misconceptions of pregnant women, I can't think of any right now.
Okay.
I can't think of any right now.
Okay, so let's talk about how the campaign is going. You've talked about what the government is doing in upgrading and training the healthcare workers. So let's also talk about, on the part of the people, how is the campaign going, especially those at the grassroots? A
lot of sensitization and advocacy is being done at the moment across the states. One of which is this media campaign I'm doing, ensuring that people do understand that we are sensitizing everyone on what malaria is. It's not what you used to think it is. It's a different ballgame altogether. In Lagos, malaria prevalence is quite low. It is not a disease that you assume that once you have a fever, it is malaria. It's a disease that things have changed, and part of what we are talking about is urbanization. So a lot of things have happened such that malaria is quite low in Lagos. Some of the other things is how to prevent. Many people, like I've just mentioned, of environmental management within the vicinity that you are in. Ensure that the environment is clean. That would actually eliminate the breeding sites such that the mosquitoes do not have anywhere to lay their eggs and then replicate. So those are the things that we are getting. And then behavioral change, where you assume that once I have a fever, it is malaria, I just start popping medicines and taking medicines. So a lot of sensitization is going on, a lot of awareness creation is going on. And we are also ensuring that opportunities that we have, where we have an organization that is doing it, or a ministry that is doing a training for a particular group of people, we go ahead to sensitize those individuals at that point in time. So we are doing so many activities across the state.
Okay, I just remembered one now when I was talking about conception, misconception, and if this is true also, I'd like you to educate us. For pregnant women, they say not treating malaria while pregnant can cause jaundice in the child when the child is born. How true is that?
Okay, now let's explain what happens when a woman is pregnant. When a woman is pregnant, she's carrying an extra body, an extra being within her. Her immune system actually goes down. So what happens is expected that when a pregnant woman is pregnant, from about when she gets, let me just speak on the part of malaria. When she gets pregnant and she reports to the facility that she's pregnant, she's given a net, and she's expected to sleep inside the net during the course of pregnancy. And she's also given her medications, antenatal care medications. From the second trimester, she's expected to take medication to prevent malaria in pregnancy, what we call intermittent preventive therapy. The medication is actually sulfadoxine pyrimethamine. It's 3 doses, which she takes monthly till delivery. So she can have up to 5 doses if she starts early. If for any reason she has malaria, she's going to be treated with the artemisinin-based combination therapy. If she's not treated, there are many complications that can happen. Or for any reason, it would affect her as the mother and then it would affect the child. Her as a mother, she can have anemia. What it means is that her blood level is low. If her blood level is low, she's the source for that child. The child will automatically be affected. The blood carries all the nutrients the child would need. In the course of that, the child does not get all the things that is required. So the child's weight would reduce. She can actually have preterm labor. The child can actually die in utero, and then the child can come down with what we call congenital malaria. Because of the fact that the child if the child is born with congenital malaria, what will happen is the body would find a way of getting, because with malaria each cell has a parasite, and then the blood takes care of it by destroying it in the spleen. So quite a number of that can happen. And when that happens, bilirubin is displaced in the blood system. It eventually affects the eyes, making it yellow. And then if it's not taken, particularly with the child, can go ahead to affect the brain. So it's possible the child can develop jaundice with malaria.
That's why it's very important for pregnant women to go for antenatal care while pregnant.
Not just antenatal care, and also ensure that they take the medications given, particularly the intermittent preventive therapy in pregnancy, which is sulfadoxine pyrimethamine.
All right, still, because we're talking about malaria, like before we came on the program, I was talking about malaria suspension versus disposable tablets, and I was saying that I heard recently that malaria suspension are no longer safe for children. So I'd like you to also educate people on this.
Yes, suspension, they are not as effective as they used to be, or should I say, they're not really effective. Why is it so? The medications are actually supposed to be diluted and then they are left for a bit. The efficacy of those, the effectiveness of those drugs reduce over time. And if for any reason the child continues to take it, even after he gets better, you know, most times we will store the medications in the fridge or any stores, generally store the medications. If for any reason the child has similar symptoms again, we assume it is the same problem and then the child starts to take it. So for two reasons, the potency, the efficacy reduces with the use of suspension, and then chances are you end up using it again, not necessarily for the same child, maybe another child, and you know, that's more or less like drug abuse. So there are dispersibles, malaria, anti-malaria dispersibles, which are given to children that you dissolve in water before you give it to the child. You are sure that the concentration is the amount that is required for that time, and is given to the child for the child to take. So it's more effective, is more cost effective, is more potent. It will do the work is required to do. So that is more encouraged than suspension.
Okay.
Sorry, and then you don't know how long the suspension has been with the pharmacy or from
the store.
In the store. So that can actually also affect the efficacy by the time they buy the medication and then use.
Okay. What are the steps that the government is also taking to curb self-medication? I know you've talked about working with some of the pharmacies to ensure that people get tested and get their prescriptions before they purchase anti-malaria drugs over the counter. In your campaign, especially to people at the grassroots, how is that going as well? And then how often should one get tested for malaria? Or I know they say for your teeth now, visit the dentist every 6 months. So for malaria, do I have to wait until I'm feeling sick before I get tested and treat myself?
I'll start with the second question first. Okay. Malaria diagnosis is not a screening test. I don't go to, maybe there's a screening program and then I say I want to test myself for malaria. No. The only reason why I'm going to test for malaria is because I have a fever. So if there's no fever, there's no need for you to go ahead and test. So that's why we don't even encourage you having sites that you call malaria. I'm doing malaria screening here because what are you screening? The person does not have fever, so what are you screening? So the malaria test is for diagnosis, to identify whether that fever is malaria or not. So that's the only time you're expected to get tested. Now let me ask for the first question again. Can you kindly repeat the...
Okay, yeah. What measures are you taking to curb self-medication, especially those at the grassroots?
Self-medication is an attitudinal act. The important thing is like an awareness. It's continuous sensitization, really, because people have to change their ways to ensure that they get tested. You know, these are things that have been used to for so long. So it's an attitudinal change, and it's continued sensitization, it's continued awareness, advocacy as well, to ensure that the people understand the essence of, you know, ensuring that you're taking the medications when you are required to, not just popping in medications because you see them available or you assume that I have an illness. If you're not positive for malaria, if you're not, you know, if you don't have the parasites, why are you taking the medication? And people don't realize that these drugs are actually poisons. You're giving work to your liver, work to your kidneys when you don't need them. Why? So it's to, you know, work with them to understand that there is need for you to ensure that you don't take these medications arbitrarily. You take them when required. So it's a lot of sensitization is going on.
This conversation will not be complete, I feel, if we don't talk about agboiba, because there are people who are strong crusaders for taking agbo. And they believe that, oh, you have fever, take agbo they work. So I'd like you to also address that. Is that safe?
Agbo is herbs. It has herbal concoction. We don't know how those things... It's not, I didn't make them. You probably didn't make them. Many a time you steal them by the roadside. What is the content of the agbo? What did they put in? Sometimes they even put anti-malarials inside of them and sell as agbo. in addition to the herbs. The problem is the quantity. First of all, you don't know what the content is. And then when you're even giving them out, or when people are buying them, what quantity should one take? That cannot be identified. And then you're doing a lot of, like I mentioned, these things are actually, they can actually act as poisons within one. Your liver would have a lot of work to do. You don't know what those things are, whether they have some, whether they contain certain things that can be harmful to the liver, that can be harmful to the kidneys. And then the person will now end up with more problems than should. You have liver problems, you have kidney failures. So these are I would discourage it. I would actually discourage it and encourage everyone to ensure that they take medications that have been prescribed, not just anything by the roadside, because these things are poisons. You are taking in things that can end up doing more harm than good. The hygiene of how safe or how clean those things are, you don't know. You would end up having more problems than you started with. So it's not something that we encourage. And like I mentioned, it's still a bit of attitudinal change, because it's something that many people have been used to. So you need to inform them that, look, these things are not right. They're actually wrong. They do more harm than good. You taking them, you may think that it's working. But what's the guarantee that they did not put anti-malarial in what it is that is supposed to be working? And you assume that you ascribe the effectiveness to that, to it's working. So it's more of attitudinal change, a lot of awareness creation, sensitization on the part of the government.
I know you've talked about this before, but I need you to emphasize again the preventive measures, because malaria can be preventable. Preventive measures that one can take, to be sure that you and your family are safe and secure from malaria.
Firstly, we have our nets. Many people complain that it is hot using it. But would you rather have fever? Would you rather have malaria than? Because if you think of the economic cost, let me bring it down. A child has, or even you, let me use a child. A child has malaria. Supposing the child maybe also has siblings as well, who, everyone is taking care of, and the child ends up in the hospital. Everybody's life is disrupted. You'd have to go to the hospital to stay with the child. What happens to the others? They are more or less like neglected for that time being. You're going to spend money, you're going to spend time. The other children, somebody has to take care of them. It may be, it doesn't necessarily have to be you. Maybe you can even get an extra pair of hands. They may miss school because of that. The child gets better and then return back. But you spent money, you spent time based on that. So it's a lot of things have happened. You have, disrupted so many things. Then you're going to look at, if it is you as an individual, it will mean that you are going to miss work. You're going to miss work. You're going to miss if you are bringing in money for any reason, or if what you're doing is a daily.
Do you need water?
Yes, I do.
Okay.
If what you're going to do is a daily, it's something that you're bringing in money every day, you're going to miss some money. You'll be able to provide for the family at that time. You have also that has also affected you, and you are looking at the inconvenience of sleeping inside the net. But you have forgotten that you are going to spend money trying to get yourself better. You're going to spend money, you're going to spend time trying to get yourself better, and then try to recuperate too. You need some time to away from work. So when you think of all of that, the economic impact, how much is it compared to sleeping inside the net for a few hours in a day? Then definitely it makes more economic sense for you to sleep inside the net. That's one aspect. And then you're also reducing mortality, because for any reason, particularly with pregnant women and children under 5, if for any reason that they are ill, you're looking at their morbidity, you're looking at their mortality. They can get, if they for any reason fall ill, they can end up, they can be deceased following that. And that would also add to the burden of the country. And when you're looking at a country that is doing well, you're looking at those mortalities. If the mortalities are low, the country is doing they are high, the country isn't doing well. So if you think about the essence of the nets, as ordinary as they are, they go along with this. There's so many things that they do prevent. So that's one aspect. The other aspect is the environment. I keep emphasizing that because these are things that we can easily do as individuals. And what do I mean by that? Ensure that the environment is clean. And if everybody does their own part, I'm not asking you to go anywhere within your sphere of influence. Your homes, your spaces at work, if you're in school, for whatever your compound, by the time everybody does their own bits, you'll be surprised at how much breeding sites we have gotten rid of. And mosquitoes do not have anywhere to stay. Gradually it will go. And then at the same time, you want to ensure that for any reason, if you're ill, you get yourself tested first before you start taking any form of medications. So that would also assist. You're not just assuming that it is malaria and you're just taking haphazardly. That would also reduce resistance. And then abuse of medications for any reason, other types of medications. Some people will tell you that, okay, so if it's not malaria, let me assume it's antibiotics. And start typhoid. And start taking medicines that are not required. So there are so many aspects and so many ways that, you know, you can look at it. And those are the things that we encourage people to ensure that they do. And then if you are pregnant, ensure that you take the medications, the required medications, you sleep beside the net, and you take the intermittent preventive therapy in pregnancy while you're in that pregnancy. Ensure that you do the needful. So that gradually, if we continue to do that, the prevalence will continue to reduce. And before you know what's happening, you as an individual, you've done it, and the next person has done it. You may over time eliminate malaria from the states and the country at large.
We'll take a short break now. When we return, the conversation on malaria prevention will continue. Stay with us. Thank you for staying with us. We are still talking about malaria prevention and management campaign in Lagos, and we still have with us here Dr. Abimbola Oshinowa, and she has really educated us today about malaria, what the state government is doing, and things we should stop doing regarding malaria. I'll just give us a little brief again about the things that we have talking about preventive measures. As she said, sleep with under a treated net. You know, a lot of people have complained about the heat, but it's better to suffer the heat than fall ill and then start treating malaria. And she has highlighted how that can affect. She gave an example of a home, how that can affect the home. Clean environment, get tested before medication. Did I leave anything out, Doctor?
No.
Okay, so I'm a good student.
Yes, you are.
All right, just as we begin to wrap off this segment, take us, what future steps is the state government, taking to also ensure that Lagos can be totally malaria-free? Is that something that can happen?
Oh, yes, it is. And like I mentioned, malaria is not just a Ministry of Health problem. Everybody has a part to play, and I'll keep emphasizing it. So with the state government, when we start as individuals, the parts that we need to play, I've highlighted quite a lot about it. At the same time, a lot of capacity building programs are also going on for our health workers. Awareness creation to the populace, ensuring that they understand that they have a part to play. Community engagement, because when within the community, the information that we are talking about, they're the ones that can assist us to enforce it. We're looking at our CDAs, World Health Committees and all of that. So when we know, because they already are stakeholders within their sphere of influence, they are able to handle information and ensure that there's enforcement on the part of the people within those areas to do the needful. The same thing we're also looking at a situation where, we continue with ensuring that our pregnant women and children under 5 are covered with all the activities that we're doing. So we are nets that we give to them at specific times, like a pregnant woman who comes to the public facility is given the net free so that she can use it throughout the course of her pregnancy. And then our children under 5, when they come for their measles vaccination, they're also given a net so that they can also use it till for as long as they can. So the same thing I've talked about our capacity building of health workers, the availability of medications, anti-malaria medications in our facilities as well. We want to ensure that those are continuous because, like I said, everybody has a part to play. Community engagement is why I need to emphasize the community engagement is because that is quite key. When everybody is able to understand that I as an individual have a role to play, and within this community, if I can get rid of malaria, the next community I can get malaria. Little drops of water will end up making a mighty ocean. The political class as well, our government ensure that funding is available. Everybody, if we are all holding our hands in that regard, then there's no way malaria will not be eliminated from the state, and that is what the state government is doing.
Beautiful. For the treated nets, how long can it last?
As long as 5 years.
Okay, even after washing?
No, you need to wash. You wash with mild soap, not medicated soap. Okay. So unmedicated soap, mild bar soap, the ones that are locally available. There are quite a number of them. No, you can use ordinary water. But then that's the washing aspect. But when you get it, you need to spread it under shade for 24 hours before you begin to use. Not under sun. Not under sun. Under shade, so that the chemicals can fix properly within the fabrics in which they have been put and activated before you take it in to use. Then when it's dirty, wash with mild soap, not medicated and not detergents, because those would actually kill the chemicals or reduce the efficacy of the chemicals within the nets.
For those who skip the spreading under shade, what happens?
They can begin to react to it, and many of them will tell you that when they use it, it stings their body, their eyes, they're affected, they can't breathe properly. We discovered that quite a number of times you don't spread it properly. You don't spread it for the period of time, and if you take it back, if for any reason you still feel that the chemical is still strong, take it back out and leave it under shade for a period, maybe another day before you bring it in.
Most thank you again, Dr. Abimbola Oshinowo, for sharing insight on this topic, malaria prevention and management campaign in Lagos. She is the manager, Lagos State Malaria Elimination Program, and I believe that everyone who has listened to this conversation has taken a thing or two from it. Thank you again for your time.
Thank you so much for having me.
The program continues shortly. Stay with us.